typically what we're looking at is extreme fear and anxiety in social situations where there's perceived potential to be negatively evaluated. So this could be feeling judged by peers, embarrassed, but we're looking for extreme fear and anxiety in those particular social situations specific to the fear of being judged or evaluated by others. We're also looking at social situations are always or almost always going to bring on that fear or anxiety, as well as a tremendous amount of avoidance, or if a child or adolescent is able to engage in the situation, they are reporting that they are enduring a significant amount of anxiety and discomfort the entire time that they are in the social situation. We're also looking at fear and anxiety that's typically out of proportion to the actual threat. So an example here that I talk about with children and adolescents might be giving a presentation in a class, right? So if you know that that's a presentation that's going to be graded and that's going to impact your class grade significantly, that may feel like an actual threat, as opposed to initiating a conversation with a friend that you've had for a while. That actual threat might be different. Avoidance of feared social situations, or when functioning is significantly impaired while engaging in the feared situation. So again, an example here with school might be a child or an adolescent who, while attending school, is unable to function in their academic classes, is tearful, is shut down, is experiencing panic symptoms, which I'll talk about a little bit as well, is unable to retain the information that they're learning, even if they're physically there in the building. And lastly, we're also looking at fear or anxiety that must be present in these social situations for at least 6 months. Really want to focus on is how much is this impacting day-to-day functioning? Are they able to do the things that they want or need to do with some regularity, right? So thinking about an adolescent or a child who maybe from time to time is saying, I feel really overwhelmed. I don't really know if I want to hang out with my friends today, or I didn't really want to participate in class today. I felt really uncomfortable, right? That's sort of what we would call normal anxiety, as opposed to maybe a more consistent or persistent pattern of avoidance, of isolation, of drop in grades, or difficulty being able to do the things that are expected or needed to be done. Paired with, we could also talk about some intense physical symptoms that tend to present themselves with social anxiety as well. So for some children and adolescents, the social anxiety might be so overwhelming that they may also experience panic attacks or panic symptoms. And again, we're checking in there around physical symptoms, nausea, sweaty palms, racing heart, difficulty breathing, and we can manage that through the use of some coping skills and communicating effectively with people that support us. So what social anxiety typically might look like in children and adolescents when we're thinking about avoidance or fear? Like I said, either some children and adolescents are actively avoiding versus engaging in some of these social situations while experiencing a tremendous amount of anxiety and discomfort. This may also be like specific classes based on content, based on teacher, based on the amount of students in the classroom, ordering food at a restaurant, ordering food when they're at Starbucks, ordering food at a drive-through, presentations in class, making small talk. This can be really difficult for children and adolescents with social anxiety, right? Knowing when to initiate a conversation, how to maintain a conversation, and ultimately how to wrap up a conversation. Maintaining eye contact for some, it's even just a second of eye contact. For some, it's extended periods of time. Initiating plans with friends, right? Being the one to say, hey, do you want to hang out today? Let's meet up here. What's everyone doing this weekend? Maybe scheduling or meeting with teachers individually can be really difficult, or reaching out to teachers via email, asking questions. Eating in public can also be really hard for children and adolescents with social anxiety. So this could come up in a cafeteria setting, out to eat with friends, even at home sometimes, as well as using public restrooms. So this list could probably go on, but just some really common examples of how this might present itself with children and adolescents. We also talked through the panic and the physical symptoms, which again, we know that if we're experiencing those physical symptoms, which usually are very uncomfortable, that can also enable more avoidance, right? If I know that I might experience these really uncomfortable physical symptoms, I don't want to experience those in front of other people, that then leads to more avoidance around the fear of judgment. We also might see some anticipatory anxiety prior to social events or interactions, right? Lots of what ifs and fears about specifically what could happen. You know, we also tend to get a lot of questions about like, what's the difference between social anxiety or being shy? And I think just to note that certainly plenty of children and adolescents who are socially anxious present as quote unquote shy or quiet or can fly under the radar in group settings from the perspective of not wanting to draw attention to themselves. But again, like this could also look like crying and tantrums and clinging behavior, refusal to speak, especially in children. And I think just noting as far as red flags or maybe changes over time, we really want to highlight significant avoidance or maybe a dramatic shift or change in behaviors, decrease in grades or difficulty attending school regularly, maybe a change in areas of interest, or your child or adolescent may say like, I really do want to go to soccer, and the reason I'm not going is I am so uncomfortable, I'm so fearful of judgment. And just noting that when we talk about social anxiety versus shyness, that shyness is more like a temperament, right? This is sort of maybe how we have been historically. It's about comfort level and less about that specific fear of judgment. You know, the first step would be if you have concerns for your child or adolescent, I usually always recommend, right, speaking to your pediatrician or primary care physician, connecting with school supports, people who have seen and know your child and adolescent for an extended period of time. And then from there, if the thought or recommendation might be some therapeutic interventions, certainly there's a lot of options available. So individual therapy that's focused on learning some, let's say, cognitive behavioral skills. Here at Compass, we focus on exposure and response prevention therapy, which I can talk about a little bit as well. There's lots of opportunities for social skills training, whether that's in a group setting outside of school, or a lot of schools do offer social skills training groups. Ways to practice making mistakes. And we talked about group therapy, as well as at times family therapy can be really helpful, right? So just to kind of talk about each of these interventions a little bit. Social skills training arguably can be helpful for most children and adolescents. And what we're talking about here is opportunities to engage in structured role plays with other same-aged peers, where maybe feedback is provided by the therapist or the social worker, or feedback is provided by other peers. There's something really helpful and powerful about engaging in these role plays with other same-aged peers who can say, yeah, that felt really great, or that was a little bit awkward, let's try it again. Receiving some positive reinforcement through those social interactions. And then a really important piece is quote unquote homework that can be completed outside of therapy in real life settings. And this is a common theme that will come up, whether it's through social skills training, whether it's through skill use, whether this is through exposure and response prevention therapy. We really want to take what we're learning, whether it's in a group setting or an individual therapy setting, and apply it to real life situations as well. When engaging in mistake practicing, which I know can sound a little bit silly or weird when I'm explaining it to children and adolescents, we're really encouraging them to test out that hypothesis of what they think might happen. So for example, mistake practicing could be bumping into someone when walking, or if you're at a restaurant, ordering something that isn't listed on the menu. So again, we want to sort of check in of what is the hypothesis, what do we think will happen, and then what ultimately did happen. Similarly, with exposure and response prevention therapy, this is engaging in structured exposures, whether that's in the context of the individual therapy sessions, group therapy, and again, out in real life settings where we're confronting our fears and anxiety and sort of testing out those hypotheses as well. So I kind of love talking about what specific exposures might look like for children and adolescents in school. This might be raising your hand in class one time when you know the answer, right? So we practice that for a few days, and then it might be raising your hand in class when you're not sure about the answer. And again, we want to check in, like, what was the feared outcome? What did we think was going to happen? And what actually did happen? The goal is over time to find that more often than not, our feared outcomes don't really happen. And if they do, we are typically able to manage that anxiety better than we predicted we would have. And so over time, we do start to see a shift and change in especially that avoidance behavior. Another key piece with social anxiety, I think, is helping children and adolescents identify safety behaviors, which we define as the things that we do to try and get out of our anxiety, right? So some examples might be someone who uses a cell phone while talking, right? So this might look like engaging in a conversation, but having your cell phone and looking down. This is a way of managing that anxiety and discomfort in real time. Another example might be sitting in the back of the room in a class so that you can avoid making eye contact or being called on. The more we're aware of those safety behaviors, we can start to gradually remove the safety behaviors so that we're fully engaging with the anxiety, so that when we have our takeaway from that exposure, we can say, my anxiety was at an 8 out of 10, and I was still able to sit in that classroom and engage in class that day. I think also just noting that typically over time, whether it's through mistake practicing or exposure therapy, we might see that the anxiety tends to decrease. More often than not, I am encouraging parents to push gradually, consistently over time, while also having conversations about finding a balance. So I think we want to gather a little bit more information from our child or adolescent when we're thinking about accommodation. An example would be with school, right? So if our child or adolescent is saying, I feel so anxious going to school, I don't want to go, I'm constantly worried about judgment from peers at school, I don't want to go. This is an area where I would recommend and talk to parents about pushing. The other piece here is I think it's helpful to talk about modeling the behavior you want to see. So if our children or adolescents see us getting anxious and our response is to avoid or to pull away or to say, I'm feeling really overwhelmed by this and therefore I'm not going to do it, then that's a little bit of a mixed message if then we're saying to our child or adolescent, the expectation for you though is to do it, right? So I think it can mean just taking a look in general about how anxiety is managed at home for all of us. When we talk about accommodation, I think just a general definition here is anything that we do to try and ease or alleviate our child or adolescent's anxiety. So accommodation would be participating in safety behaviors. This would look like saying, okay, you're too overwhelmed to go to school today, let's just take it off the table, or picking them up early from school if they're texting saying I need to get out of here, or even just letting them go late, or consistently avoid situations where anxiety is present. What we know about accommodation is it's a slippery slope, it's a vicious cycle. The more accommodation we provide, the more our children and adolescents want it and expect it. So they rely on the accommodation to quote unquote manage their symptoms. And I say quote unquote because it's a false sense of management, right? We know that once they receive the accommodation, maybe their anxiety decreases for a period of time. And then of course the anxiety reappears, they seek the accommodation to help manage the anxiety, and the cycle goes on. The over-reliance on accommodation also, again, models that we don't think that they're able to sit with or manage that distress on their own. And we want to model that, yes, this is overwhelming, this is scary, and we believe that you can do it. And so this is where we might, intervene with some coping skills, or maybe being creative. Is it something that you feel like you could do for 10 minutes? Is it something that you're willing to try, knowing that I will come back and get you at 1:15 or whatever that might be?